Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery
improve.
of Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. I have with me today Dr. Heather Young. She's an associate professor of pediatric infectious diseases at UAMS. Dr. Young, thank you for being here today.
Thank you for having me.
So we're talking about whooping cough. What are the primary symptoms of whooping cough, and how can they be differentiated from other respiratory illnesses?
Yeah, so whooping cough it's a disease that is spread very easily, and the primary symptoms, it has three different phases. So you start off, there's something called, they call it the catarrhal stage, and that's a kind of a low-grade URI symptoms. You know, the kids aren't too sick during that, and they're just a little bit of a runny nose and everything. That lasts for a week or two, and then they go into this paroxysmal cough. That's the one that is classically very distinctive, especially in toddlers and school-age kids. And that is the cough where you have just these very, how do I put it, episodic. Like, it's not constant. It's just every once in a while they'll have a coughing fit. And they just cough and cough and cough. They can hardly walk across the room. And they'll do this thing that sounds like a whoop. They'll take this deep inspiration in, and that's where it gets the name whooping cough. So they'll get that whoop in and then just cough and cough and cough. And they'll cough so hard, often they'll throw up. They'll just use their stomach muscles so much that they'll actually just vomit. And it's not that they're nauseous. They just cough so hard that they gagged themselves. So that lasts for 3 weeks or so, actually a little bit longer than that. Then after that, you go into the convalescent stage, and you just keep coughing for a really, really long time, and it gets gradually and gradually better. They used to call it the 100-day cough because this cough would just last for 100 days. And it's a miserable cough, even in the convalescent stage. When I was in residency, there was a small outbreak, and one of my co-residents got it, and he broke his ribs. He was coughing so hard. So it is a miserable cough. He was an otherwise healthy, 20-something-year-old. So,
and how is it transmitted? What are the primary ways that it spreads in communities?
So it's spread through droplets. So you cough, and it comes out, and then there's a little bit of roll of fomites as well, but it's mainly just coughing up these droplets. It's not nearly as contagious as, say, measles or chickenpox or something like that, and it doesn't spread as far, but definitely if you're in close contact, if you have kids who are sitting next to each other in school, they're coughing it all over each other when they're sitting right next to each other, and those are the kids who are at risk.
So can a person with whooping cough spread the disease before symptoms appear, or is it only contagious when symptoms are visible?
So yeah, you start being contagious during the catarrhal stage. We don't think that you're contagious prior to that. But the thing is, the catarrhal stage is pretty insidious, and so people may not actually remember exactly when they started having a runny nose or something. And especially in, say, younger kids who just have their back-to-back colds from being in daycare, that phase is a little bit hard to differentiate. But you are contagious until 3 weeks of the paroxysmal stage. So when you've been coughing and hacking and everything, that's for 21 days afterwards, honestly.
And you mentioned schools and children. Are there particular environments or situations where whooping cough spreads more easily?
Yeah, any congregate settings where you're in close proximity to others. So churches, so schools, any sort of clubs or anything like that, household contacts, those are all great places to transmit whooping cough.
And why is it particularly dangerous for infants and young children?
Oh, so instead of whooping, infants tend to just stop breathing, is the thing. And so it just is very overwhelming for them. They'll have apnea, can develop a pneumonia. The disease can kind of overwhelm their lungs, and they'll often develop pulmonary hypertension as well, which is not a fun thing to have to manage. Infants often need a tertiary care center to help support them through this illness.
And how effective is the vaccine? Tell us a little bit about it and its effectiveness in preventing it.
Right. So the DTaP is actually 80 to 85% effective after you've gotten all doses of it. So the problem for infants is they don't get all doses. You get it 2 months, 4 months, 6 months of age, and then a booster at 12 to 15 months. They don't get that full dose yet, so they're not as fully protected. But once they've gotten everything in, they're 80 to 85% protected. The issue with the DTaP and Tdap is that it wanes with time. So when we think that about after 5 years after you've been vaccinated, its activity is only about 50% of the time. So we often see peaks in the teenage years. Kids will get their vaccine booster at 11, and then it's the 15, 16, 17-year-olds who start spraying it around themselves. And then, the kids that they're babysitting or their younger siblings that they're passing it on to is really kind of how things spread a lot.
And what recommendations are there for adults regarding the DTaP vaccination, especially for those that may be in contact with infants?
Right. So if you have a loved one who is pregnant and is expecting, we recommend that you get your Tdap for adults, Tdap. You get your Tdap, 2 weeks before you start, you're going to interact with that baby to help protect the baby.
And what treatment options are available for whooping cough? And are they effective in reducing the severity of symptoms or maybe the duration?
So the earlier you catch it, the better off you are. So if you can catch it in the catarrhal stage or very early paroxysmal stage, then the treatments is the first line treatment is azithromycin or clarithromycin. Most people do azithromycin because it's pretty common and readily available. But if for some reason somebody can't tolerate azithromycin, then Bactrim is your drug of choice. So it can reduce the symptoms if you catch it early enough. But however, a lot of times people aren't caught until sometime in the first or second week of the paroxysmal illness. And once you're that far in, then honestly, you're just reducing the amount of infectivity. It's not going to reduce your symptoms at all. You're still stuck with a 100-day cough.
And you mentioned earlier about these coughing fits. Is there anything that can be done to manage those that often accompany the disease?
Oh, I wish. But unfortunately, they have studied, do we do steroids? Do we do cough suppressants? Do we do anything? Nothing actually works. Everything just gives you side effects. So I hate to tell patients this, but I'm like, this is just going to go on for a while and you're going to be miserable for a while. And I'm sorry, there's really just is nothing to give.
And are we seeing an increase in whooping cough cases in recent years? And if so, what's contributing to that?
So during the COVID year, so from 2020 until 2024, we really had not been seeing any whooping cough. We had record low numbers. We've seen pre-2020, every few years, you'd see a little surge in cases and everything. But this year, 2024 to 2025, it has been an anomaly where we have had very high rates of cases, some of the highest rates since 2013 or so. What's going on behind it? I think that there's a lot of there's a lack of vaccine uptake, especially a lot of kids during the COVID epidemic maybe didn't get their 11-year-old vaccines or whatever. They've missed those vaccines. And so we're seeing more cases because of this.
How can healthcare providers help educate the public about the importance of that vaccination for treating pertussis outbreaks?
I mean, the best thing to do is to go be an advocate in your community. Studies have shown that people trust their pediatrician more than anybody else. So more than anybody that you see on the news or, the more than signage that you put up. So if you can talk and go out into your communities and tell your patient population how important these things are, go talk to school board meetings or what have you. That is probably the best thing that people can do to help.
And can it cause long-term health issues? Is there lung damage or chronic coughing?
So no, aside from infants who had severe cases in infancy, no, it usually doesn't cause any prolonged kind of, disease or distress afterwards. But It's bare to have it when you have it.
And how long does immunity to whooping cough last after vaccination? Is this a lifetime?
No, unfortunately, about after 5 years, your immunity tends to wane. So that's part of the reason why we keep seeing these little peaks every once in a while, and why we're in the middle of a large peak this time.
And how does that peak compare to the national or global rates that you're seeing elsewhere?
I don't have national rates right now, but I know that everywhere is seeing a surge in pertussis, basically across the United States. I don't have any numbers to say to what extent, but it is everywhere.
Well, Dr. Young, thank you for talking about this important topic. I appreciate your time today.
You're welcome. Thank you for having me.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.